In your morning medical news, people who work the night shift and eat at unusual times of day are more prone to weight gain and diabetes. That's because signals between the liver and brain get disrupted, leading people to overeat. But a new study from the University of Pennsylvania found that when testing on mice, those signals can be adjusted, leading to more normal eating patterns. Nearly 3 million U.S. adults have epilepsy, according to the CDC, but many people don't know much about this brain disease and the seizures it can cause. In honor of Epilepsy Awareness Month, Mandy Gaither has what to know about this spectrum disorder and explains what to do when someone is having a seizure.
It's one of the most common neurological diseases. Epilepsy is a chronic brain disorder that leads to abnormal electrical discharges within the brain, causing recurring, unprovoked seizures.
It still carries quite a lot of mystery amongst the general public.
Dr. Dilip Nair with Cleveland Clinic says the severity of epilepsy varies from person to person, but it can affect anyone at any time of their life.
People who aren't really aware of the disease, it can look scary.
That's why Nair says it's important to know what to do when someone is having an epileptic seizure. There are 3 things to remember. First, keep the patient safe. Make sure they're not bumping into anything. Do not restrain them, and don't put any objects in their mouth. Next, turn them onto their side.
So that if there is vomit or saliva that's coming out, it comes out of the body rather than back into the lungs.
And stay with them. Time the seizure if it lasts more than 5 minutes. If they're injured, having difficulty breathing, or experiencing repeated seizures, Nair says to call 911 immediately.
Many people who have epilepsy have rescue medications that are prescribed, and if you're a caregiver or a family member and you have those medicines, you can use them as prescribed by your doctor.
Doctors say there are dozens of anti-seizure medications and new therapies being studied. That includes gene therapy that can help patients with epilepsy. He says there's also epilepsy surgery for those patients who have drug-resistant epilepsy.